Are morning erections normal, and how frequently should they occur? I'm Dr. Peter Whyte, a urologist. Firstly, why do men experience morning erections? It's not solely due to erotic dreams or sexual thoughts. Morning erections are a normal aspect of male physiology. We refer to this as nocturnal penile tumescence. These typically occur during REM sleep, the phase when vivid dreaming occurs. REM sleep usually happens in the early morning, explaining why men often wake up with an erection right after this stage. Many remember their teenage years, often waking up with an obvious indication of morning wood. But what's considered normal after teenage years? Interestingly, this phenomenon has been studied over decades. A notable study conducted in 1975 included 125 healthy boys and men ages 3 to 79 in a sleep lab. They were monitored for brain waves, eye movements, and changes in penile size during sleep. Each participant spent 3 nights in the lab. Researchers focused on the middle night for the most accurate data. Only individuals without sleep issues, erection problems, or medications influencing outcomes were included. This allowed the establishment of baseline data for healthy individuals. From early childhood, around ages 3 to 9, nighttime erections begin occurring consistently. As boys transition into preteens and teenagers, this frequency peaks. During this phase, erections are most frequent and last the longest while asleep. The average duration of these episodes during REM sleep in early teens is about 40 minutes. This indicates that approximately 40% of total sleep time at this age involves erections. Post-puberty, the average length and occurrence of nighttime erections gradually decline, stabilizing at around 20% of sleep time, roughly 1.5 hours per night. The average duration of each erection in this phase is about 30 minutes. On average, individuals experience 3 to 5 erection episodes throughout the night. You may wonder if the quantity of REM sleep decreases with age. Interestingly, that is not the case. REM sleep remains fairly consistent after teenage years, with most adults achieving about 100 minutes of REM nightly. A more recent study examined how erections change with age using a specialized device to measure nocturnal penile tumescence. In this research, 40 healthy, sexually active men aged 20 to 60 participated. None had sexual dysfunction, sleep issues, or medications affecting sexual performance. Each man spent a night in a controlled environment where the device tracked their erections. This study found occurrences of erections across all age groups. However, blood flow to these erections diminished with age. Men in their 20s exhibited an average blood flow increase of 268% of normal. By age 50, blood flow averaged around 200% of normal. While the quantity and duration of their erections remained stable, the average number of occurrences was approximately 3.78, with the longest lasting around 31 minutes. Subsequent studies since the 1970s validated these findings in other healthy male subjects. What's the takeaway? You should experience morning or nighttime erections into your later years. While frequency and duration peak during adolescence, they tend to gradually decline with age. If you observe a lack of morning or nighttime erections, it may warrant further evaluation. The reasons can be varied. Regular nighttime erections indicate proper blood flow, hormonal health, and nerve function, all crucial for penile blood flow. A lack of erections may suggest underlying issues. Changes in your waking erections or sexual performance, along with potential symptoms of low testosterone, could arise. I recommend those noticing these changes check testosterone levels as they correlate with nighttime erections. Occasionally, men experience low testosterone, initially reflected through reduced nighttime erections. It's essential to examine overall lifestyle factors. Maintaining a healthy weight is vital. Engaging in regular exercise, including resistance training and aerobic activity, is crucial for optimizing blood flow and hormonal health. Additionally, managing stress and ensuring quality sleep will enhance blood flow, genital health, and overall well-being. In summary, morning erections serve as a health indicator. A decline may signal you need to reassess your overall wellness. Importantly, it can reveal issues before they escalate, like erectile dysfunction. Consider this a message from your body regarding your health. If you find this content valuable, you might appreciate my newsletter. Each week I discuss men's and women's urology topics, sharing relevant new research. We also address a subscriber's question weekly while keeping you updated on my current projects. If you wish to stay informed, don't hesitate to subscribe today. It's completely free. Always remember to prioritize your health as you deserve it.